Hi, I'm Dr. Bornstein, and today I'm going to talk about ear infections and what we call middle ear infections because they happen in the middle ear, or in the medical field, otitis media. So I have a picture here of an ear, and we have the outer ear here, which is that. We have the ear canal, which is where a swimmer's ear happens. I have another video on that one. We have the middle ear, which I've circled. That's what we're talking about. Middle ear infection. And we have an inner ear, which is where you have the bones, the incus, the stapes, the malleus, the bones of hearing. Infections don't generally go that far, and they're dangerous if they do. We have a eustachian tube, which is a little tube that drains the ear. So when you have an ear infection, you are getting fluid behind the eardrum, and it's getting infected. So you get a bunch of fluid back here, pushing the eardrum bulging, like that. When I look at it through here, it's red, and I wrote red here. I'm going to hold this higher. I wrote red here, and it's bulging toward me. When I look in there, I have a little thing, a little tube coming off my otoscope with a little insufflator. I have this coming off like that, and I give this thing a little squeeze. It blows air against the eardrum, and if the eardrum doesn't move, it should go back and forth, back and forth, back and forth. If it doesn't move, it means there's fluid pushing against it, and that would be a middle ear infection, red, immobile on insufflation. If that's the case, then you have an ear infection. Well, what do you do with that? I'm going to put this down for a second. Well, you don't have to treat a middle ear infection. They typically go away if you did nothing. And a bunch of studies came out probably 10, 20 years ago that said that something like 85% will go away without treatment, maybe even more. Ear infections existed before antibiotics, and children did fine. So you don't have to treat. A lot of times if we don't treat, we do like to look at the ear maybe 3-4 days later to make sure it's going away. But people who are really against using antibiotics, it's okay in this case to hold off. But most people want treatment. They want their child to get better a little faster, be sure. So we treat. And what are we treating? The bacteria that cause a middle ear infection are typically 3, H. flu, strep pneumo, and Moraxella catarrhalis. Weird name. And sometimes a little bit of staph. Since the Prevnar vaccine, the strep pneumo has gone down, so we've mostly got Moraxella and H. flu, a little bit of staph. Most people still use amoxicillin. That's the standard, gold standard treatment for middle ear infections. I have tended over the last few years to shy away from that because in my little area, my little niche, there's a lot of resistance, and I have a lot of patients, or had a lot of patients coming back that it wasn't getting better, too many, and so I start going to what most people probably now use as their second line, which would be a cephalosporin like Ceftonir or Augmentin. So I go a little stronger. There's probably some debate on that, and you can't fault someone for going with amoxicillin, or I think you can't fault someone for going for something a little stronger. It depends on what they're seeing in their area. And so I go for the treatment. So you treat and you get the bacteria out of this area, and then the fluid hopefully drains down that eustachian tube. Well, sometimes that doesn't happen. Sometimes you treat and it's still there. There's still fluid there. That could be because the eustachian tube is clogged and this can't drain, or because the eustachian tube maybe in children is a little straighter, so we're not getting good gravity to get it down, or because the mucous membrane in the middle ear is continuing to produce more fluid, so even if it's draining, more is coming in and it's not going away. And if we get a lot of ear infections, I usually say 6 and 6 months, or one that won't go away after 3 10-day treatments, then we start talking about putting a tube in the ear. What is a tube? Let's make a little space here. So you have the eardrum. You have all this fluid back there, and it can't go anywhere. So a tube, basically, the ear, nose, and throat doctor makes a little cut, suctions, goes in, suctions all this out, and then puts a little tube, which is just a little opening. And what that does is one of two things. One, it allows the fluid a way to come out. So now you're having fluid coming out. So you think you put the tube in, you hope it just goes away, but sometimes it just gives a place for fluid to come out and you have a constantly draining ear. Or sometimes it just makes the ear infections not happen. Opening this up decreases the pressure in the middle ear. Sometimes you have what's called negative pressure, so stuff's getting sucked in there And this gets rid of that negative pressure so stuff doesn't get sucked in there anymore and you don't get an ear infection. So you can put a tube in the ear, and usually it stays in, depending on the type of tube, a year, 2 years. There's tubes that last about that long. There's longer tubes that last longer. And usually for the first tube, you'll do a simple one that just falls out on its own. So you get an ear infection because you get fluid behind your middle ear. I see it a lot of times after colds. They get a runny nose. I think the same mucous membranes that are in the nose are in the middle ear, and so they run. You get an ear infection because bacteria sets into that and it bulges up against the eardrum. And then you treat it with either what we call watch and wait and recheck, or you treat it with oral antibiotics. And if it's not going away with oral antibiotics, then you put a tube in the ear to help decrease the negative pressure in the middle ear, and also to give a port for the fluid that's in the middle ear to drain out. And that's your basics of a middle ear infection, otitis media. Thank you.